Hi guys, hope you got through the hurricane just fine and you are ready to get back to action next week. This is the podcast for teaching and learning for week 3. We're going to talk about reflection and active learning. All right, I'm not sure if y'all have had podcasts in any other class, but for my podcasts, I will post the PowerPoint. So if you want to pull it up and take any notes along with the PowerPoint, you can. For this podcast, we're going to go through some things and then we'll talk about it a little further in class on Wednesday. I sent an email, but in case you didn't get it, the reflective journal that was due this Sunday will not be due. It's a group activity, and I don't know where most of you are. I don't expect you to be able to get back and get with your group before Sunday night. So Wednesday at the beginning of class, I'll let you have enough time to do your group activity that will be your reflective journal that you turn in. All right, this week we're talking about reflection. And so our objectives are to recognize the value of reflection as a clinician and as a lifelong learner. Describe reflective practice, including the elements underlying to reflective practice. Link reflective practice to critical thinking and clinical decision making. Apply the elements of reflection to enhance your own critical thinking. Develop effective questions to facilitate critical thinking and reflective practice, and use the questioning process as a basis for creative problem solving. So last week when we talked about the learning cycle, we talked about experiencing things, that some people like to sit back and reflect before they jump in. Some people like to try things. Some people never reflect. They just do and they never learn. Well, without that reflective piece, you're not going to improve who you are as a clinician. So I like this saying, experience is the basis for learning, but experience is not enough. It is what we do with our experiences that allows us to learn from them. And this is another one of my favorite sayings. I had a clinician say this years ago and I loved it, but you could become a physical therapist with 20 years of experience, or you can become a physical therapist with 1 year of experience that you've repeated 20 times. It's your choice. So I'm sure you know people that have a lot of skill at what they do, and they continue to get better. I work with clinicians that have been therapists for 30 or 40 years that really haven't changed or improved. I also have worked with clinicians that have been therapists for 30 or 40 years and know more about treating patients because they continue to learn. Make sure that you're that therapist that 20 years from now you have learned everything you can within those last 20 years. You don't just take what we taught you in PT school and stop there. But the big problem is there is so much to learn. So while you're in PT school, we do teach you the needs to know and the nice to know things. There's much more to learn. And so how do you know what to learn, what you need to work on, what your weaknesses are and what your strengths are? Well, this reflective process is where you need to begin. All right, so what is the reflective process? It's a process where we search for connections of what we already know and what we've experienced in the past and make sense of our current experiences. New knowledge and new experiences linked to what you already know equals improved learning. And I'm going to make this a reality. So in your second year, you have one-day clinical education experiences. Now you learn some patient care skills specific to acute care in the spring semester of your first year, and you will start some musculoskeletal content, but you're not going to be independent with treating patients. So why do we do these clinical experiences? How do you feel that helps with learning? The thing that we want you to start is to practice what you're doing, be able to reflect on it, and be able to understand what you need to work on more. Linking these experiences that you're doing in the classroom with true patient care in the clinic will help to solidify learning, and it will also help to let you understand what your strengths and weaknesses are. Right, conscious reflection. Many of us reflect on what we do, but you may or may not have made a conscious effort to do so. And this is something you're going to need to do to continue to be better each day. What does conscious reflection do? It helps to facilitate deeper learning. It goes beyond just memorization, and we're going to talk about memorization here in just a second. It enables you to explore multiple perspectives. So when you reflect, you can think about how you did it and then maybe how else it could have been done. It helps you to reframe the problem. So if you were looking at a patient case, having reflection may make you think deeper or think different ways about that problem. It also helps you to question the assumptions. So you made assumptions about what you were doing and about the patient, and it makes sure that you're looking at things from different angles. And it also helps you to analyze your own experiences. So when it comes to memorization, think back to undergrad. How many times did you have to memorize things for an exam? Did you use flashcards? Did you write things out? Think about all the subjects that you memorized information. And now think back to how much of that information you still remember. Hopefully, you remember it all. But the reality is there's probably very little that you memorized that you still have in your memory. There's going to be things in graduate school, here in PT school, that you have to memorize. So don't lose those skills of being able to learn, but realize the majority of what we're going to do is going to take that information and apply it at a much deeper level. You're going to have to be able to take those facts that you know and use during critical thinking. This is the importance of some of the things I'm doing with journaling. I teach you things. I want you to realize that what I'm teaching can be applied to you in different situations. The journaling activities are meant to help solidify classroom activities. There's going to be a lot of different ways that the instructors here in PT school help you to not just memorize, but be able to apply that information. Right. Reflection in healthcare is the hallmark to excellent clinical practice. It is key to critical thinking, and it is how you become a clinical expertise. If you've had the fortune of working with a clinician who is an expert in their field, they don't have a cookbook process to treat each patient. They think about what's going on with the patient. They critically analyze and constantly reflect on their actions. All right, so what is the definition of reflection? It's an internal process that relies on the cognitive and affective behaviors we engage in to gain new sights into a deeper understanding of our own experiences. So let me explain this a little better. When we're talking about cognitive and affective behaviors, cognitive behaviors are the things we know. These are facts. This is based on your both intelligence, how hard you've studied, and your ability to remember things. Affective domain behaviors are just that. They're behaviors. This is your willingness to work hard, to care about patient excellence, and your ability to work hard to get what you want. You need both affective behaviors and cognitive skill to be able to accurately use reflection. All right, we're going to talk about 3 different types of reflection. It's going to be reflection in action, reflection on action, and reflection for action. So what is reflection in action? So it requires you to function at 2 different levels simultaneously. So you must be able to attend to the patient and interact with them, but continually questioning, observing, and assessing to see if our actions throughout the session improve the patient. This is done often at an unconscious level, and hopefully everyone in healthcare, especially in physical therapy, is doing this. So you're thinking as you're mobilizing a patient's shoulder, am I getting the results that I want? If I changed my position, could I improve the results? What am I missing? If this didn't work, what else could I do? This is something that a great clinician does throughout the process of patient care. The next is reflection on action. This is when you reflect on what happened and ask yourself what worked, what didn't work, and why. Why did you miss the cause of the outcome? Conscious use of the reflective process is essential in developing expertise. So things you can think of when you're doing reflection on action. What happened? Why did it happen? Could it have been different? what else could I have done to play into this situation? How did my actions reflect or impact the income, and how did the patient's actions impact the outcome? All right, and then reflection for action. This occurs after you've had time to think about what happened and how you may do something differently next time. And the goal of reflection for action is to anticipate the problems before they arise. So you may have to have a background to know that, of what happened in the past and what we could do differently next time. Questions you may ask yourself is, what would happen if? Or how could I do even better next time? Or if I saw a patient that presented similar to this in the future, what would I do? And so again, I'm going to go back to this slide that you can become a PT with 20 years of experience, or you can become a PT with 1 year of experience that you've repeated 20 times. It's your choice. If you use reflection in action, on action, and for action, and you are constantly striving to be better, you will become better as a clinician. We can also look at reflection from content, process, or premise. Content revolves an analysis of the problem from the perspective of everyone involved. It can be from the patient, from the physician, from the rehab tech, and the PT. Process reflection is how you can determine how you might approach the situation differently. Then premise reflection is to question and analyze your own assumptions or the assumptions of the underlying problem. So which of these do you think is the hardest to do? For most people, it's premise reflection. They don't want to admit or even think that the biggest part of the problem may be them. They want to think that maybe it's a case that, physical therapy can't benefit, the patient can't benefit from physical therapy, or something happened at the doctor's office, or the patient is not improving because they're not following your home exercise program. Don't forget to think of how you could do better in a situation, because there's many people involved with patient care, and the one that you can control the most is yourself. So premise reflection is more reflection in action, where reflection on and for action are related to content reflection and process reflection. All right, now we're going to talk about critical thinking. And we talked a lot about this during the orientation process, and you'll hear about it throughout your time here at Methodist. With critical thinking, you recognize assumptions, beliefs, and values that underline the decision-making process. You help to solve problems, and not just solve them, but you're able to justify your actions and anticipate what you think is going to happen. So anticipate the potential outcomes. You also need to be able to extract a deeper meaning from experiences and to apply whatever you experience now to other situations. That will help to enhance your clinical abilities. Right, so what do expert clinicians do in clinical practice? They're able to use their own intuition and their own thoughts, feelings to inform the analysis and interpretation of clinical data. So they elicit multiple perspectives, they seek alternative solutions, they question their own assumptions, but they also recognize the limits of their knowledge. They are able to self-critique. The best clinicians are also the ones that will ask often for more information. They're not scared to say, I don't know, and then find something out. The use of questioning can help with this critical thinking aspect. So there's questions, instead of just asking basic questions from the patient or from your coworkers or from your clinical instructor, there are better ways to have thought-provoking questions that help you find a deeper meaning of what you're doing. So questions such as, what's stopping you from, or what would happen if? You can also say, what strategies have you tried? What other strategies might you consider? What would your ideal solution look like? What else might you do in this situation? What worries you the most about whatever you're doing? And are you being totally honest with yourself? Often, if you take the time to critically assess at the end of each day how you treated each patient, You may find over time you will be more honest with yourself because you're going to get better at patient care and also at that self-reflective process. If you're not critical on yourself, you're probably not going to improve. All right, the APTA has core values for the profession. You may have completed this in Foundations, and Dr. Mitchell isn't around for me to ask. If you have not completed the core value for professionalism, please go complete it. I have posted it on Blackboard, but if you are completing this in the future or have completed it for Foundations, then you're already done with this assignment. It's not something I'm going to have you turn in. I just want you to truly self-assess and begin this reflective process that I've been talking about through this podcast. And here's some good questions that you can think of while you are going through the self-assessment. What areas did you feel that you demonstrate the core values set forth by the APTA, and what areas did you struggle with? Are there any areas you feel you may never consistently meet, and why? And in the time that you've spent observing in physical therapy and observing physical therapists, did the PTs that you worked with demonstrate core values? Give examples. Maybe think of some examples of how someone did or did not demonstrate those core values. So this is another way to think deeper in this self-assessment. If you're not sure of the meaning of something, you can look at it and say, well, I've seen a PT. Do I feel that they met these core values? And if they did, that's somebody that you want to make a role model. If they didn't, you want to be better than that. So, all right, that's all for this podcast. Like I said, we're going to do the activity in class, so I will have that ready for you when you get there Wednesday, and I'll have you break into your groups, and we'll take a little bit of time so that you can do your assignment on Wednesday, and then we'll continue with our lecture. Thank you.